come to the interview.
Thank you so much for having me.
I'm Felicia Austin. I'm the Human Resources Director for Restorative Care.
Yes, ma'am.
And we are looking for CNAs that have recently graduated and passed their state tests. So I just have a couple of questions that I'm going to ask you. Take your time,
Okay.
answer, and if we need to come back to a question, just let me know.
Yes, is it okay if I take notes?
Yes. Tell me about your experience as a CNA.
Well, I'm recently certified, so I received my certification this month. I don't have any job experience, but what I do have is I've worked in childcare. I've also worked as a babysitter, and I just have a passion for helping people. And so that's why I actually went to CNA school, and I wanted to go ahead and pursue my CNA certification and hopefully in the future become a nurse. So I don't have any patient care experience, but I am willing to learn if you're willing to give me an opportunity.
Have you taken care of any family members?
I have. I've helped to take care of my grandmother, and then my mom, she's also a CNA. So some of the, terminology when I was studying for my test, it was so cool because she also was able to help me. So we do have caregivers in our family.
Okay, that's great. How do you handle difficult or agitated patients if you were to have one?
Well, with the kids, going back to my job experience, sometimes the kids would throw temper tantrums, and first thing I would do is breathe, make sure I remain calm, and then I would try to figure out the reason why they were being agitated or acting out. And if I could figure out that reason and console them, then usually it would calm down. And of course, if it was just, one of those temper tantrums that I couldn't get them out of, I could always call their mom. And I'm assuming that at your facility, if there's something I can't handle, I would be able to call the nurse or someone else to assist me.
Yes, that we do have our staff on hand, especially with new hires. So you will have a mentor and you will be able to shadow.
Wonderful.
For a couple of weeks. With the pandemic, so we do have elderly patients and we do have family members that come in and out. So how would you handle and what infection control measures would you follow?
Well, our teacher was huge on hand washing, and sanitization, and making sure that our uniforms, don't touch the bedding or the linen. So those are some of the things. And of course, gloving when appropriate. And if someone has a respiratory infection, then we'd be masking or, maybe a full face shield. I've not had too much experience with wearing a gown, but I assume that would be part of the criteria also if somebody has COVID.
Okay, good answer. I appreciate that explanation. We're very busy here at Restorative. We're very busy as well as being a residential. We're also, we do rehabilitative services. So sometimes it's really busy. How would you prioritize your tasks during a busy shift, which is mostly our morning shifts? Mm-hmm. How would you prioritize?
Well, with me being so new, definitely hopefully learning the ropes from a nurse or a senior caregiver. I would assume that finding out what's on the patient's schedule for the day or the resident's schedule for the day and trying to go about it that way, or asking the nurse what's the priority. And initially that's what I would do, and hopefully with experience I'll be able to figure it out myself so I wouldn't have to ask the nurse so many questions about which patient to see first.
Yes, it's very good to use your resources, and like I said, you will have a mentor and you will shadow, so make use of that. Okay. Can you describe your approach to assisting with daily living activities?
Yes, ma'am. So, of course, including the resident, I don't want to make decisions for them. I want them to be as independent as possible. So I want to ask them, instead of just picking out a sweater or something to dress them in, ask them to actually participate in their care to see how much they can help. So with things like feeding and brushing teeth, allow them some independence or as much independence as they can safely. And then what they can't do safely, then of course I would assist them with. And obviously with transfers or something of that nature, making sure they have their shoes on or non-skidded socks before we get them up and move them about.
Okay, great. So as I said before, sometimes we're dealing with the elderly, they can be difficult. And sometimes you may get one that refuses care. So how do you handle a situation where a patient refuses, I don't want to bath today, or I don't want to take my meds today?
Try to find out their why. Try to build a rapport with them. You know, of course, we still have a professional relationship, but try to actually be their friend. Because if I can understand their why, maybe they don't want to eat or take a bath right now because their favorite TV show is on. So I do believe in being flexible. Flexibility matters. I like flexibility, and I'm sure the residents would also like it.
Yes. We deal with a lot of medical information here at Restorative, and we deal with a lot of, as I said, rehabilitative. Some of our patients are well known, you know, for rehabilitation. So confidence is very important to us. What do you know about patient confidentiality?
Patient confidentiality. Well, of course, HIPAA. You don't want to share information about a patient with somebody who is not, you know, on the primary care team. So keeping their information confidential, not discussing it in the lobby, in the hallway, etc. Pretty much only sharing it with the nurse or, you know, part of the team, and maybe the CNA who will be relieving me. Outside of that, if a family member or something comes and asks questions, and unfortunately with me just being a CNA, I can always refer them to the nurse, and the nurse can answer those hard questions.
Again, use your resources. And speaking of team, describe a time when you had to work as part of a healthcare team or a team that made decisions for others.
Okay, a team that makes decisions for others. Where during the summers I work as a mentor, and as far as a mentoring team, we will actually go out to different camps and we will work with the youth. And you know, just actually being there, actually delegating tasks, because you don't think about how much we have to do in order to keep those kids safe. But you know, at the swimming pool, who's going to be where, who's actually going to, you know, who's the best swimmer if there is an emergency. Of course, we all had to learn CPR. So those, I don't have experience in the healthcare field per se, but the experience I do have with delegation is just following through, and if I'm not able to perform a task, making sure that someone else is aware of it so they can assist me. I just want to make sure that I answer that question.
Yes, and thank you for giving a very good example as well.
Yeah.
So again, patient care is our primary. Okay. And we do have some patients that they may have Alzheimer's, they may be on early stages of dementia, and they may become a little agitated or anxious. And we do have family members that are upset or anxious about something. So how would you handle a situation where the patient is anxious and the family member is anxious?
Again, trying to figure out the cause. For me, I get anxious if I'm in an unfamiliar environment, or if I'm asking someone a question, they're not giving me the answer. And so with my grandmother, when she got older, it wasn't diagnosed Alzheimer's, but she had some forgetfulness, and she was a little bit more difficult to deal with. And just being calm and reassuring, eventually things will get better. And when I couldn't calm her, I would contact my mom, who's a CNA, and she would give me some information on, you know, what I could do to help calm her down until she was there to take over.
It sounds like you're very compassionate about understanding people. That is a good quality to have.
I try.
So you mentioned transfers earlier. Can you walk me through how you would ensure patient safety during transfer or mobility assistance?
Yes. Well, first I want to actually look at the orders to make sure they have an order to get out of bed or to transfer. So actually knowing what the doctor has prescribed for this patient's activity is really important. And then, you know, speaking with the nurse or the nursing team or whoever is relieving me or I'm relieving would be important, because if they have a technique or if they use a piece of equipment, I want to make sure that equipment is nearby or in the room in case we do have to transfer the patient. Safety, keeping, if the facility has rails, because not all facilities have rails, if the beds have rails, allowing the resident to use the rails to help get up, get them to the side of the bed, allowing them time to just sit there and, for a moment or so,
gather their thoughts,
thoughts so they don't stand up too fast, their blood pressure drops, and, making sure the feet are on the floor, etc. And if I have, any concern